All right, today we're putting on our detective hats and diving deep into a microscopic crime scene. Our mission? To unmask a really notorious family of bacteria known as Staphylococcus. You know, the hidden culprits behind some surprisingly common illnesses.
So, let's kick things off with a bit of a medical mystery. What in the world could connect a painful boil on your skin, a sudden nasty bout of food poisoning, and a dangerously infected surgical implant? I mean, they seem totally unrelated, right? Well, as we're about to see, they often share a single hidden cause. It's a classic whodunit, just on a cellular level.
And here it is. The culprit hiding behind the curtain is very often a member of the Staphylococcus family. You can think of them as a gang of microscopic troublemakers, and our job today is to figure out which member of this gang is responsible for which crime.
Okay, so first things first. Before we can single out a specific culprit, we really need to understand the whole family, the whole gang. It's time to meet them and learn what they all have in common.
So here's the general family profile, their MO, if you will. Under a microscope, they look like little clusters of grapes. Kind of cute, but don't let that fool you. They can't move on their own, they don't form tough protective spores, and they absolutely love growing at human body temperature. And here's a key detail. They are catalase positive. All that means is they have a special enzyme, like a secret handshake, that helps us separate them from other bacterial families. It's a critical chemical fingerprint.
Now, within this big family, 3 members cause most of the trouble for us humans. We've got Staphylococcus aureus. Think of this one as the notorious gang leader. Then there's Staphylococcus epidermidis, the stealthy opportunist. And finally, Staphylococcus saprophyticus, the niche specialist. These are our 3 main suspects.
All right, this is where the real detective work begins, the forensic investigation. How do microbiologists in a lab take a sample from a patient and figure out exactly which staph suspect they're dealing with? Well, it all comes down to following a series of very specific clues.
The investigation follows this really brilliant process of elimination. So in step 1, we use that catalase test we mentioned. It confirms we're dealing with the staph family and not some other lookalike, like strep. Then comes the pivotal moment in step 2, the coagulase test. This test is huge. It checks if the bacteria can make blood plasma clot up. If it does, if we get a positive result, it points a giant flashing arrow directly at our prime suspect, S. aureus. And just to be absolutely sure, there's step 3, the DNase test. Think of it as the final confirmation, like a second piece of forensic evidence that locks in the ID of our culprit.
You see, that coagulase test basically splits the family right in two. Any suspect that tests negative gets lumped into this big category called coagulase negative staphylococci, or CONS for short. This test is the main fork in the road of our entire investigation. It separates the most dangerous member of the gang from all the others.
So, now that the coagulase test has helped us isolate our prime suspect, let's do it. Let's open the case file on Staphylococcus aureus and see what makes this microbe public enemy number 1. And one of its most famous calling cards is visible right here. Look at that. When you grow S. aureus in a lab, it forms these beautiful, distinctive, golden yellow colonies. That's actually where it gets its name. Aureus is Latin for golden. Pretty cool, right? It's a huge visual clue that microbiologists look for.
But let's be clear, its color isn't what makes it so dangerous. This is. This table shows the arsenal of weapons S. aureus has at its disposal. We're talking toxins that can cause food poisoning, enzymes like coagulase that basically create a protective shield around itself, and all these other factors that help it dodge our immune system. This thing is truly armed to the teeth.
And with an arsenal like that, it's no surprise that its rap sheet is long and pretty serious. The crimes committed by S. aureus range from skin infections like boils all the way to incredibly life-threatening conditions like sepsis, which is a bloodstream infection, and toxic shock syndrome. This is one formidable pathogen.
Now, S. aureus may be the leader, but what about the rest of the gang? The accomplices, the ones that tested negative for coagulase? Just because they aren't as notorious doesn't mean they're innocent. So let's profile these other suspects.
So here we can see them side by side. On the left, S. epidermidis. This one lives all over our skin and is an absolute master at infecting medical devices like catheters and artificial joints. Then on the right, S. saprophyticus. It has a totally different specialty. It's a leading cause of urinary tract infections, especially in young women. And notice that final clue down at the bottom. One is sensitive to an antibiotic called novobiocin, while the other is resistant. That's another key lab test that lets us tell these two apart.
Now, S. epidermidis has another nasty trick up its sleeve.
As this quote explains, some strains can produce a protective slime layer. Basically, it creates this sticky biofilm that helps it cling to artificial surfaces, like a new hip or a prosthetic heart valve, and it acts like a shield, protecting it from both our immune system and our antibiotics. Really tricky to deal with.
Okay, the evidence is in and the lab work is complete. It's time to bring our 3 main suspects in for one final lineup so we can close this case.
And here it is, the final rap sheet. Check it out. Look at that coagulase row. That's our first major distinction, right? Then the colony color separates S. aureus again. And finally, that novobiocin test tells the last 2 apart. With just these few tests, we can build a really clear profile for each suspect, from the highly dangerous SRS to the specialists like epidermidis and saprophyticus.
So, you might be wondering, okay, cool detective work, but why does all this matter? Well, it matters a lot, because a fast and accurate identification tells doctors exactly which enemy they are fighting. Knowing if it's the heavily armed S. aureus or one of its coagulase-negative relatives is absolutely critical for choosing the right antibiotic and giving that patient the best possible chance of recovery.
So we've closed this case for today. But the story isn't really over. Our methods for identifying these bacteria are solid, but the bacteria themselves, they are constantly evolving. So the final question to leave you with is this. As antibiotic resistance continues to grow, how will this detective story have to change for us to stay one step ahead?